Hello and a warm welcome to the programme from me, David Foster. Now, who is going to discover a vaccine first? And with that, get the bragging rights and the profits that will undoubtedly go with such a discovery. And will everybody benefit? That is far from a certainty, with international cooperation fragmented at best. In this roundtable, we'll look at how to get the world together to beat the virus. Well, is there a place for national pride in any of this, or should we be seeing a truly global response? In fact, is one at all possible?
In the war against COVID-19, dozens of laboratories around the world have become battlegrounds. Nation-states are in a race to find a vaccine. At stake are millions of lives and many billions of dollars. In a virtual summit convened by the EU, world leaders pledged nearly $8.3 billion to research COVID-19 vaccines. But the US didn't take part, and the Trump administration's lack of cooperation has alarmed global health officials. The fight is against the virus, but vaccine nationalism threatens the drive for international agreement and cooperation. Concerns are only deepening as President Trump squabbles with China and the WHO over the origins of the disease. As powerful countries pledge billions, this brings into question whether developing countries will have the same access to a vaccine. Philanthropist Melinda Gates has warned the worst situation would be if, when these tools are available, they go to the highest bidder. That would be terrible for the world. COVID-19 anywhere is COVID-19 everywhere, and that's why it's got to take global cooperation. Will the self-interest of countries and corporations disrupt the joint effort to find a solution to coronavirus?
Well, we're going to be hearing about this from a number of different angles. In a while, we'll hear from Inderjeet Parmar, Professor of International Relations at City University in London, and Heidi Chow from the campaign group Global Justice Now. First, though, let us say hello to Maria Ottiglio in Geneva, global health consultant, and in Nairobi, Dr. Amit Thakke, chair of the Africa Healthcare Federation. Maria, let me come to you first. You used to work for a group called the International Federation of Pharmaceutical Manufacturers and Associations. You know about Big Pharma, and its boss recently said, look, people shouldn't be taking advantage. This is David Ricks. I agree 100%. That would be unethical, but investors give us capital and expect a return. They are going to put, in your experience, would you say, profit before people?
Well, I don't think that this pandemic, honestly, will lead into a global conversation about the profits, especially in this case. That is what we are seeing from any sector of society. It's quite a dramatic effort on an accelerated pathway, if you want, to develop solutions, treatments, vaccines in this case. And you know, this has been possible because the industry has quite a long track record of developing solutions to combat infectious diseases. We have seen, you know, in the past, like MERS and SARS, and actually what happened with the SARS. It's quite an interesting story where industry in that case was willing and able to take the risk, but then they had to stop their endeavors and write off the cost because SARS disappeared and there were no longer any patients to help. But then you can argue.
If I could just interrupt for a second, what I'm saying to you is you would not expect a leopard to change its spots. Perhaps they are going to be putting profits before people.
I haven't said that. I think there are several solutions that you know can be taken really to mediate the two tensions, if you want, right, between public health and also you know the right for company to have returns. There has been in the past already a couple of solutions that have been put in place. For instance, advanced purchase commitment, advanced market commitments, where you know donors step in and kind of try to pull in funding to actually create a market for the purchase of those vaccines or treatment in this case. So you're talking about R&D subsidies, you're talking about outright purchase of vaccines rights by governments, philanthropists, multilateral organizations. And so you can preserve the incentive for innovation, but also give the purchaser the freedom to set the price of the vaccine. For instance,
okay, can I go to Amit for a moment, Mario, on this one? I
Mm-hmm.
mean, with your remit looking at health across the continent of Africa, do you think pharmaceutical organizations are going to be looking and thinking we must provide any vaccine we get for as little profit as possible? We must make it as affordable as we possibly can. What do you think they will do?
It's going to be a very tricky question, and I think there'll be few people who will be stand up to be counted, few companies that will probably drain in anything that they have as savings or anything that they have as costs and will provide this. But there will be quite a few who might say, at least cover my costs, at least make some kind of a margin. And there'll be some opportunists that I think will be cited after COVID is over as the boys who played the cowboy game. And I think those are the ones that we as the world need to start shunning. There'll be multinationals who will play the wrong game. There will be local distributors who will play the wrong game. And I think we should keep a scorecard. And this scorecard will be the one that we will tick, because this is not the end, this is not the last pandemic or a situation of emergency.
You see, I'm wondering who's
yeah,
going to
so
hold
you'll
them
see
to
those.
account. The World
I
Health
think,
Organization, for example. Let me just quote from Richard Horton, editor
yeah,
of Lancet, the medical magazine. He said of the WHO, it's been drained of power and resources. Its coordinating authority and capacity are weak. Its ability to direct an international response to a life-threatening epidemic is non-existent. So is the WHO going to hold the feet of big pharma and national governments to the fire and say, people out there must have it, they must have it quickly as soon as it's available, and they must have it cheaply? Do you think so?
you don't have a principal or a prefect in charge of the health of this world, first of all. For anybody out there who is a global health leader and they think there's one institution responsible, they're wrong. This pandemic has shown health is a responsibility of every leader, every president, every country, every institution, and it's not going to change for many years to come. So pointing fingers as WHO is also weak from the person who wrote it. I feel that WHO has probably tried what they have. They are no means perfect. What we need to be is part of the solution and not part of the problem. I think that quotation is misplaced, misinformed, and probably needs to be corrected.
Okay, Mario, what do you make of international leadership in this?
Let me start with a quote. I read something very nice in Financial Times where they were saying that coronavirus may be a great leveler, but it's certainly no equalizer. And I think this is like spot on. I think if we don't think globally, that in my view we will make a big mistake. And that is like in terms of the approach that we need, right? This is like an unprecedented situation. I don't think anybody in our generation has ever faced something like that, and we need like a one team approach. And this involves the pharmaceutical industry, but also the governments, also different multilateral agencies. There are so many aspects to look into, right? There is a blueprint that needs to be developed for addressing issues of financing, of global productions, of movement of goods, right? Look at all the trade barriers, for instance. There is production, dispensation, adherence, equitable access. There are so many things that we need to figure out once we will have some solution.
Who is going to make sure that there is some kind of leadership? What form would that leadership take to get the equitable distribution costs, etc., and the researching of the vaccine available to the entire global population? Who?
I can give you my take. I mean, first of all, we have seen already some sort of movement, right? There was a recently launched European Commission-backed access to COVID tools. It's called ACT Accelerator. And it's a quite step in the right direction because it's an initiative that devoted to develop rapidly and equitably vaccines and also deploy therapeutics, diagnostics, whatever is needed. There are global bodies that are existing. For instance, the CEPI, it's the Coalition for Epidemic Preparedness and Innovations, and also Gavi. They are working already on vaccines and worldwide access to them. So, for instance, if we are going to channel some of the efforts, could make sense that actually we try to boost funding for these entities so that we can ensure that products reach the most disadvantaged, because that's, I think, what's gonna be critical here.
Amit, your organisation covering healthcare across Africa, is it in touch with those who stand to make big profits from this? Is it in touch with rich Western countries to say, we'd like your help and we don't want to have to pay for your help? And if so, what sort of response have you been getting?
So that's a very good question. And we've been in touch with several foundations and several countries. You know, we set up the first Africa Public Health Foundation last year at the World Economic Forum for the same reason that you've been bringing up on this show. And that's holding leaders accountable and having Africa to become self-sufficient. The leadership of Africa CDC and Africa Union has been sterling in the last few years, and I think we might shine. So we've been in touch with, say, the Gates Foundation, the Rockefeller Foundation, the World Bank, the G7, and I think the response has been fairly positive. And I think there's been equal distribution of donations that come, like the Jack Ma Foundation. We received so many kits in Addis, and they were equally distributed to the African countries. So we are actually showing the spirit of solidarity and the spirit of togetherness when it comes to fighting the COVID-19 pandemic in Africa. I hope we can sustain it and we can rebound in our economy quickly.
Mario, tell me a little bit about the Global Vaccine Alliance and how this might fit into ending the political infighting that we are probably already seeing and certainly may see more of.
Yeah, I've mentioned them as I think, they've shown in the past to really be a global leader and to be able to provide a coordinated response. I remember, for instance, some of the case of the pneumococcal vaccine and the access in low and middle income countries, where actually the World Bank and Gavi helped design and launch the 1.5 billion pilot to advance one of those advanced market commitments that I was discussing before. I think whoever it is going to be very important that actually there is some global response, because we have seen already a lot of statements, right, when it comes from some of the country leaders that the doctors, the scientists, the communities is talking about finding a global vaccine, but then national leaders are emphasizing that immunizing their own population first. It's very important, like in the US, in China, or in India. So I think to avoid that and to avoid what happened in 2009 with the swine flu, I think a global answer is needed, and Gavi or other bodies are definitely fit for purpose.
There's a guy called Gerald Posner. Let me come to you, Amit, as we wrap up this section of the program. He wrote a book called Pharma Greed, Lies and the Poisoning of America. He says they're all in this race. That's the big pharmaceutical companies. It'll potentially be a blockbuster for the industry in terms of sales and profits. The worse the pandemic gets, the higher their eventual profit. Where's, as you referred to in your last answer, the spirit of cooperation in that statement?
I think what you're talking about is, when I meant the spirit of cooperation, I feel I meant the global leaders, people who are looking at the bigger picture. But now I think you brought in the pharma side, where you brought in the greed and the profit and the mucky stories we hear about the pharma. I don't think we've actually exited that. The pharmaceutical industry is going to be tested again in this pandemic. If you remember the HIV/AIDS situation, and you remember Ebola, I can't even name a single pharmaceutical company that you can say could be counted as coming out of its shell to help the world. Many of the pharmaceutical companies kept guarding their share prices, kept looking at its supply chain. And I think we need to look and reposition pharmaceutical companies around the world and ask them to rethink what their value offering is in the global health. It's not about pushing the numbers of vaccines or pushing the pills. It's now refocusing on the value of health. They have a lot.
I'm going to have to say, Amit, I'm going to have to say thank you at that point. Thank you very much indeed. Also to Mario Ottiglio, we appreciate your time, the time you've given us coming on this program. And we should remember, of course, that you mentioned AIDS. Amit, there is still no vaccine for that. We appreciate your time. Thank you very much indeed.
Thank you.
Thank you.
I mentioned these two at the top of the programme. We can say hello properly now to Inderjeet Parmar, Professor of International Relations at City University in London, and Heidi Chow, Senior Policy Manager from Global Justice Now. Great to have you on the programme. Inderjeet, first of all, something you said interested me. Global politics has changed because of this, and we will see this play out in the rush to find a vaccine and its distribution. In what way? Can you give us any examples of what you think is going to happen?
Well, in previous pandemics, for example, it's been very difficult to get the right vaccine to the right people, particularly if they're not living in rich countries and they can't really afford to pay for it. And given that big pharmaceutical companies spend billions of dollars over a long time, it becomes very, very expensive. So the issue is going to be, one is finding the vaccine, but second thing is, because the whole world needs a vaccination, who is going to be able to afford it? How are they going to distribute it? And how are governments going to deal with the very large amount of demand from home to get the vaccine first? So that is the kind of competition or vaccine nationalism or medical nationalism, which I think is going to break out. And I think we've already seen signs of that with the EU summit meeting last week, which the US refused to attend. The Chinese were only last minute persuaded to send an ambassador, and the Russians weren't involved and the Indians weren't involved either. So I think there's going to be
any sort of any global winners if that is the case in this, or do attitudes have to change? Do you think they will change?
Well, I think there's going to be a kind of pragmatism, a pragmatic position at which the world is going to find itself. And that is going to be that there has to be global cooperation, but in the short run, governments are going to be under a lot of pressure to get that kind of the vaccines to their people very quickly. So there's cooperation in terms of finding a vaccine, in terms of scale of production, which is required, which only a few countries have, and then the popular demand. I think it is possible to manage it, but it's going to show all the fault lines which have developed in world politics today. All of those are going to be visible. And that's going
okay, I will ask you in a moment, if I may, to explain how you think it can be managed. But Heidi, I want to come to you first of all, because I know that one of your major concerns is that rich countries may well produce the virus, they will want to hang on to it for their own citizens, and that the poorer people in the world will be last in the queue. Again, how do you deal with that? What Inderjeet and I know you both refer to as vaccine nationalism.
Yeah, I mean, I agree with what's been said already, that actually in the recent history tells us this has happened already. So in the last H1N1 pandemic, vaccine supplies were brought up in advance by rich countries, leaving very limited supplies for low and middle income countries. And so what we think needs to happen around this is that there's been a lot of public money that's been pouring into the research and development of a new vaccine and treatments as well. And we think that governments should actually put conditions on that public funding to ensure that any vaccine discovery is not patented. This would enable any vaccine to be openly licensed, which would mean as many manufacturers as possible can then.
Well, I sort of get that, but you're asking the big pharmaceutical companies, the producers of any of these possible vaccines, to suddenly become saints, aren't you? Because they've got to make money because they have shareholders, and we mentioned that in the first part of the program. You're asking them to give up their money-making arm, which they say they need to have to do research and development.
But the industry also needs to realize that almost every research project on vaccines at the moment, on COVID-19 vaccines, is actually being supported by public funding. And so public funding needs to deliver public health goals. And actually, at this moment in time and during this pandemic, this is kind of not the time to be profiteering from a crisis that is affecting the whole world.
You'd have to make it the law, though, wouldn't you? Because they are not going to act out of the goodness of their heart. Just because you say to them, you're getting public money, you've got to do this, they need to have their arms twisted. By whom?
Well, most of the leaders of the world, particularly the main leading states, they're referring to this as a war. And they're saying that this is our generation's world war. What happened in World War II was that the entire society, economy, culture, politics, everything was mobilized to fight the enemy. And what we've got here now is an enemy which is threatening every single state. And that requires a degree of unity. that means government action to take control of corporate interests and turn them to the national and global interests. So in the Second World War, for example, arms manufacturers, other factories were told what to produce, how much to produce it for, and the state was the main buyer of it. And I think that's the kind of level of emergency that we're currently facing today. Because if we leave the system of
wondering about you mentioned the war, at least that came to an end. We heard today from Boris Johnson, UK Prime Minister, this is May the 12th, while we hope for a breakthrough, hope is not a plan. A mass vaccine or treatment may be more than a year away. And this is the bit that concerned me. Indeed, in a worst case scenario, we may never find a vaccine. War without end. How do you hold together any global alliance that may possibly come along in a situation like that?
Well, the key issue is that nobody knew that World War II was going to end in 6 years. A lot of people thought it'd be over much more quickly. In the end, what can you do? You have to protect your people, protect your economies, give people a decent livelihood. The capabilities scientifically, technologically, and in terms of industrial production are all there. The issue is to turn human ingenuity through cooperation to solving this greatest problem of our generation. So no one can say that there's not going to be an end to it, but on the other hand, there's nothing other than trying to overcome this particular problem. And I think we know that we face very, very large-scale problems on a number of different fronts. But the only thing you can do is, rather than to break up into separate nations or blocks, or to separate companies which are competing with each other, I think there's got to be a degree of governmental control, as there was in that wartime period.
I think even in the eventuality that no vaccine is discovered, because it's not a guarantee, there are treatments that are being trialed right now, and there could be treatment breakthroughs, if not vaccine breakthroughs. But I think the principles that we've discussed would apply to both, that actually we want to see global collaboration. We want to see patent-free technologies that are open and accessible to the whole world, because this is a global pandemic where we do need global collaboration and when we do need to work together. This is about making sure that that everyone has access to these health technologies. And if this pandemic has taught us anything, it's taught us that we're only as strongest as our weakest neighbour. And so we do need a community response. And on a global scale, we need a global response where everyone acts together, working towards one direction.
Yeah, it might have been one of the reasons why we got here in the first place. Globalization, which then led to people being dissatisfied with that, which led to populism, and now we have a great many world leaders around. Great many world leaders who look to their own nations first. That is going to make life a little bit more difficult, is it not, Inderjeet?
It already is. We can see President Trump, not only globally but also nationally in his own country, he favors his allies, and he tends to attack his opponents. And we can see that the different states which are governed by Democrats, cities which are sanctuary cities which are defying immigration policy, are being treated very differently. The federal government is leaving a vacuum. I think in the global scene, the US is also leaving a vacuum. But into that vacuum are stepping other powers. Some of them are on a nationalistic basis, some are on a regional basis, some are even on a global basis. So we saw the EU response. We're seeing the Middle East realigning in regard to giving aid to Iran, where the US is applying sanctions. So I think we're seeing a number of different tendencies competing with each other. But I think in the end, there's going to be a greater level of nationalism, but a necessary nationalism perhaps. But what we have to guard against is xenophobia, which is one nation against another. And that is the kind of politics of President Trump, which I think we have to be very wary of. That's probably the biggest, most dangerous development.
Heidi, I'm wondering if some of what Inderjeet has just said gives you hope that there are, while on the one hand you may have nationalist countries, nationalist leaders, there are others who are stepping into the breach, that there could be some kind of consensus, that the medicines might be able to get to those who need them the most if and when they are discovered. Are you hopeful?
the language coming out of the WHO and from some global leaders around equitable access and the commitment to that through the WHO accelerator, for example, they're all making kind of the right noises. But what we really need right now is for global leaders to now turn the rhetoric into concrete action. And the sort of concrete action we need to see is binding commitments to ensure that vaccine supplies are reserved for countries in the global south. We need to see commitments over public funding to ensure conditions are attached to ensure access and affordability, as well as open licensing, because these are the sorts of measures that will enable truly equitable access. I think just saying it and hoping for the best, or saying it and relying on pharmaceutical monopolies, that's not really going to cut it. And so, I think what's been said globally, the same sorts of things we've heard some global leaders say, is encouraging. But now we need to see, like I said, the concrete action to back it up.
Appreciate your time, Heidi Chow. Thank you very, very much indeed for coming on the programme. And of course, if no vaccine is found, then the global south, as you refer to it, as is going to need more help, probably with all the way the world's economies are going, than it does if a vaccine is found. Heidi, we appreciate your time. Thank you very much indeed. Inderjeet, thank you for coming on Roundtable once again. Great to have your company. And thank you for watching this edition of Roundtable. I'm David Foster. We hope to have your company next time. In the meantime, stay well, stay safe, and if you can, stay with us. Bye-bye.